Good morning, guys. Well, we have done enough videos on diffused pattern baldness hair transplant results. Today, one more such case with results we would like to present to you. Here, this patient suffering from diffused pattern baldness, and the important point to be remembered in this patient is he is already 43 years old, and that's the age of the patient. He has been taking few multivitamins and other things, but it's kind of there was no improvement, and there is a family history of baldness. But for him, unfortunately or fortunately, whatever it is, he is not suffering from complete male pattern baldness, whereas his case to be turned out to be like diffused pattern baldness. So such kind of cases we already made enough videos, but each diffuse pattern baldness cases looks different, and for their hair transplantation plan and design is totally different. So that's the story of today. Well, kindly watch the video until end to understand how we plan surgery for him, why we need to plan this way, and what are the final outcome. That's what we're going to discuss today. Look into the case. Well, this gentleman aged 43 years walked into our consultation. On examination of this case, he had a beautiful donor, and there's a family history of normal male pattern baldness. Whereas surprisingly, this guy is suffering from a diffused pattern type of baldness. He tried kind of the local serums, even minoxidil, couple of years, but he was not getting that good results. That's the idea he observed from couple of years by using local conservative medicines and remedies. By looking at his age and having a very good donor, we recommended him a transplant. This case especially, we made something like a tailored kind of a customized plan, because each person has a different kind of baldness, and we need to understand what kind of design we're going to design on him so that we're going to get a best camouflage. That's the basic idea. On examination, this case doesn't look like a simplest one, whereas I understood kind of frontal hairline and little backside the frontal area. He's supposed to get a good hair, otherwise he doesn't look better in the front, from the front side. And another point, even lateral right side and even left side also, there is a gaps are seen, and that's not going to be pleasing. So we need to fill that area. Well, it comes to the backside, crown area as well as mid scalp, also there is a baldness. That's a kind of difficult task to surgeon implanting hair in all the area in single session. Only frontal forelock, little bit amount of hairs are there. Otherwise, frontal area, right side, left side, and even in the back area, there is a considerable amount of hair loss has been happened, and scalp has been showing up. So usually diffused pattern cases, when you implant hair, there is a risk of losing further ongoing hair loss may continue, not because of hair transplant, that maybe could be part of age or part of hair loss progression. But when you consider implanting front, right, left, and back, we need to be very meticulously planned, and we need to design such a way that he is going to get best outcome in first session itself. Okay, or else sometimes you need, at times we need second session also. So this patient we planned such a way that we designed a beautiful hairline plan, and when I observed before taking photographs and after taking photographs in the direct visuals, indirect visuals in the mirror, and even in the photography, all these three made us to understand which area exactly we need to implant the hair. That's the plan basically. Without this plan, just like looking at a patient, and if you try to implant the hair, it doesn't give a good results. So basically on examination itself will give us a clear picture and indirect visuals like looking in the mirror and even in the good photography can make beautiful ideas before starting the transplantation. So well, we implanted because of the donor was very good, we implanted frontal area, right side, left side, and few in the vertex crown area, also a little in the mid scalp, and not in the frontal forelock. So this turned out to be kind of an excellent outcome after 10 months when the Cumming test was done and checking it kind of density we achieved under bright sunlight and for the flash camera, the beautiful density we achieved it. This is not only because of the graphs, this is because of the artistic technique we used to get a better camouflage. That's what we achieved in this patient. So well, results after 10 months, it came out completely, kind of awesome results and excellent outcome, best density, and you can see a natural blending hairline. No one would know that you've done a transplantation. And if you see lateral sides, right and left, even in the back, any position, any angle, if you see the better camouflage we achieved, that's a beautiful hairline and beautiful density we achieved. It's not only because of having the good number of grafts, it's kind of a best plan and design we achieved it. We planned it during the consultation. What does the patient need? Probably patient can tell many things, but the way we observe to be totally different. We see in a different angles and plan the design during the procedure. We take enough time to think about making the plan. That's the most important. That turns out to be best outcome in this patient. So getting this always doing a transplant surgeries on diffuse pattern patients is not a joke. It's kind of a challenging. So here not only hair transplant alone can get you hair, and kind of a best design and plan also can make sensible results and best outcome. The conclusion of this kind of patients are usually age has to be considered. Imagine this patient has a age of 25 years or less. Definitely we would not recommend transplantation procedure, because I'm sure he's going to lose more hair within 6 months and 1 year and doesn't turn out to be good results. So minimum has to be 25 or above, or a little more better for the diffuse pattern cases, because he is almost 43 years. There is no reason to wait. That's the reason we planned a transplantation procedure, and he's already tried lot many medications. So that's another reason from patient side too. And always diffuse pattern cases are challenging for surgeons and team, because here a simple transplant technique doesn't make any sense, because if you can see, a lot of the patients comes to me just simply implant in the frontal hairline, and that looks so horrible, and botched transplant from lateral views or from backside, it doesn't look good at all. So point is, we need to design by looking at a direct vision, with direct visuals, by examining the patient and then taking a photography, and then photos we need to understand which angle is looking which way, which is the area more highlighted areas, then how to implant, what is the density we are going to give there. All this has to be considered, then only we can achieve a best outcome. So that's the importance of best expertise hands and passionate minds to get an artistic outcome. And that's what about this story. Thanks for watching our videos.